It's just about a minute past 7. We'll give people more time to come on. Looks like everybody's queued up, waiting to get into the webinar. We're up to 240 and it's counting. So we'll give people some more time to log on. In the meantime, settle back, relax, have something cold to drink, have your dinner. Yes, Rob, I was looking at my watch, but it's I'm tracking my beats per minute. Trying to keep in a respectable beats per minute range. We appreciate everybody who got on, just before 7 and at 7 o'clock. Given the large size of the group that we've got entering the webinar, it is taking some time for people to get in. It's a rather long line because everybody is 6 feet apart. And so we're sure that everybody will get in who needs to get in. So please hang tight. All right, we're just about pushing 7:05. We've got 284 people out of 500 registered on. We'll just give another minute, just to remind everybody that we are not using the hand raised function. We're not going to be calling on anybody. We'll be handling all questions by Q&A. Our preference is that you hold off on your questions until the very end, because we probably will answer most of them. So write them down on a piece of paper, have them ready, and then at the end you can submit them if we did not answer them. With the number of people coming on tonight, we're trying not to keep this going for 2+ hours. So let's. I think, Rob, once we hit 300, we'll start. How's that sound?
Sounds good to me.
All right. Well, we got 8 more people to go. Okay. Well, there we go. I'm going to start out of respect for everybody who did get on in time. We do appreciate it. And as the others join us, I will probably have to remind them about the Q&A process. But first off is welcome everybody to the reopening Massachusetts for youth sports. We're in phase 3, step 1, and we'll cover the levels that we're currently operating on. I think, as most of you know, Massachusetts did reclassify soccer, and thus that's the need for this webinar. In addition to that, there's a lot of new questions coming in that pertain to games and the playing of games. So I'm going to move at a rather brisk pace as we go along so that we have more time for questions. A lot of the information I will be covering tonight is in the latest bulletin that we sent out with the links to the guidelines that have the highlighted updated sections. And so, if you have not read the guidelines, please do so immediately after. It may answer some questions you have already, but we appreciate that the questions coming in are more clarifications and a little bit of interpretation as compared to us just simply rereading what's in the guidelines. So we appreciate that. So here we go. Let's see if I can get this rolling. Okay, so as I mentioned, we're going to use the Q&A tab. All questions must be submitted using the Q&A, and we will answer questions at the completion of the slide presentation. So in order to help out with this process, write down your questions while we move along, and if not answered, then enter into the Q&A. Now, please keep your submissions to questions and no commentary, rants, or whatever else you want to submit, because only those presenting, Rob and I, are the ones who will see the questions. Of course, if we do answer a question, we will then post the question up for people to see what we answered. But beyond that, we're the only ones who can see it, so our favor is just post questions, and that would be appreciated. Thank you. So tonight's webinar, we're up to 300 people. We had 500 people log on, and we sent out the announcement to our Mass Youth Soccer member organization leadership. This is our town programs, clubs, and leagues. We sent it out pretty much to everybody that participates in the sport of soccer here in Massachusetts. So not only Mass Youth Soccer members, but also members of other soccer organizations. So our target audience is the leadership. Now we understand that there may be others in attendance. There may be some parents and or coaches, and that's great. We're glad that you're on. We're glad that you've taken the time out to dedicate yourself to understanding what's taking place, and we appreciate that. Everybody's welcome, but just so you're aware that our content is really geared towards the leadership, the folks that are helping us to get soccer up and running out on the fields. So let's take a step back. This is a slide I used in when phase 3, step 1 was first announced. I'm not going to go through all those. I just want to mention again that there was a multitude of sector-specific task force teams, I think at least 100 or something across the board. This included everything from restaurants and bars and gyms and nail salons and spas. I can go on, and youth sports. Now, the Executive Office of Energy and Environmental Affairs was given the oversight and the guidance for directors related to reopening of outdoor recreational activities and businesses in the Commonwealth. So youth sports was one part under the EEA. They're dealing with everything having to do with hunting, fishing, fishing boats, guided fishing boats, chartered fishing boats, beaches, hiking trails. I can go on. And then it, of course, included youth sports. So the folks at the EEA did a phenomenal job on helping to pull us all together. Also, they were instrumental in helping us get the audience for the reclassification. So personal thanks to everybody at the EEA and in the Lieutenant Governor and Governor's office for listening and helping and assisting. Once again, the two driving factors behind any decisions, as we all know, if you're watching the governor virtually every day on his press conferences, is the numbers, the data. What are the numbers? The most important one that they've been tracking is the positive results to testing ratio. We've been hovering 1.7, 1.9. As long as we're down below 2, we have a very happy governor. And one of the other things that they did take a look at in the last few weeks was to see if the data changed, if the numbers changed from operational youth sports, softball, baseball, the no contact lacrosse, which is girls lacrosse, and tennis, and all the other sports that have received permission that were low and moderate risk. And the feedback is that the numbers still look good, that these sports have not contributed to any spikes or surges with regards to the data that's being collected. Because the tracing, as anybody who's been involved in it has been called up or anything along those lines, the tracing is actually keen and pretty on target. And the other key to factor is the mitigation for the chance of respiratory particle transmission. And so when, we talked about it before, when soccer was originally classified as a high risk, it was put into that category based on various parts of the the decision, but one of the big key factors was the contact. That contact in soccer is permissible. And so we were categorized with all the other sports where contact is permissible. But we believe, based on the information that we shared, the research that we've shared, the statistics that have been out there, we were able to demonstrate that contact in the sport of soccer is rare and infrequent at most ages. Now, we do understand as you get up into the high school ages and the such that there tends to be a lot more contact, especially shoulder to shoulder challenges. But for the most part, for youth sports, the contact is low. The other part of that is that the majority of kids playing soccer in the state, the large majority are ages 14 and younger. The numbers that we have from U3 or U4, U5, all the way up to 14s is the largest share of those playing the sport. So we feel that we were able to demonstrate that that even though soccer does involve contact, that there's not as much of a chance for respiratory particulate spread or particle spread or transmission as first thought. So prior to 724, the risk categories were listed as the low, moderate, and higher risk. I believe most of you have probably seen this. This is prior to 724. And what I've done is I've highlighted in higher risk soccer, of course, and then I also highlighted crew and sailing. And the reason is that after we stated our case, some other sports as well wanted to make sure that they were heard. And so, and on 724, these are the changes that appeared. Soccer was recategorized as moderate risk along with crew and sailing. And then they included, which was omitted prior, was dance class and fencing. So these have been listed as moderate risk when they weren't in there before. But so soccer, crew, and sailing went from higher risk to moderate risk. Now keep in mind, just because we've had a reclassification does not give us permission to just go out there and do anything we want. It's the farthest from the truth on that. We are not saying, okay, it's just play as usual. It is not, and we'll talk about that as we move forward. So in the levels of play, you've got the 1, 2, 3, and 4. 1 is the individual or socially distanced group activities, which is what soccer was up until 724. And then Level 2 and 3, which is what moderate risk sports were categorized. So they could do level 2, which is competitive practices, intra-game or intra-club. These are, if you've got a town program and you want one team to compete against each other in level 2, that's totally permissible. They can go ahead and do that. Or intra-club, if if the club's got 5 or 6 U12 teams and they want them to all compete against each other in level 2, that is permissible. The other part, I'll touch on some of the other differences, but and then level 3 is competitions, which is basically inter-team games meets matches. So let's take a look at what soccer is all about right now. Soccer, phase 2, step 1, levels 1, 2, and 3, based on the July 24th amendment. We are permitted to do levels 1, 2, and 3. So let's take a look at these a little bit more in detail. So all 3 levels are in force. So what does that mean? Well, level 1 is still in force, which means as much as possible, and we'll touch on this in a second, but as much as possible, 6 feet of distancing should be maintained. You try everything possible to maintain distances. But the higher levels may replace the lower level restriction, which in particular for level 2 is practices may include contact drills. Now that's a term that the state uses. As we'll touch on later on, I don't know of any coach that specifically just simply runs a practice for our youth, for the, for youth players that focuses on contact drills. We don't have, like football or rugby or, those types of contact drills. But it does include contact drills. For example, in field hockey, classified moderate, allowable contact in field hockey is stick to stick. In no contact lacrosse, allowable contact is also stick to stick, but it's not body to body. So what this kind of means for us is there's no longer a need for players to maintain 6 feet of distancing during exercises that may involve contact. So if you're running an exercise on defending, you can now have a player go up close to an attacking player, and then they can practice their tackling technique. And what we're suggesting is it's practice their poke, foot poke or a foot block, but no shoulder to shoulder. And we'll touch on that later on as well. It's highly recommended that players maintain 6 feet of distance when not participating in exercises that may include contact. Okay, for example, if you're using the play, practice, play model, and then during the practice part, the coach has you out doing game-like activities for your practice. If there's no tackling or there's no tight defending, keep your distance. Try and keep the players apart as much as possible. And then the other distances in town and intra-club games and scrimmages are now permitted without restrictions. So they can play the game the way it's meant to be played. However, once again, I'll touch on some potential restrictions that may come later on. But now games can be scheduled. Leagues can schedule their games. Towns can and clubs can play friendlies, on level 3, town against town or club against club. And then league play, of course, can start to be scheduled. So this is what soccer is all about moving forward. So I have a couple slides here I'll share about what has and has not changed. So no change. 2, specifically for practices. For teams and groups, no more than 25 player participants can be on a single playing surface, which is a field, at any time. And the number of coaches and staff should be limited. There's no reason to have 4 coaches out on a playing surface with 21 players. Especially if it's a team, the team probably has a roster up to 18 or 19. So, there's just no need to have that many coaches out there. We do not need, the lower the number of adults we have on the playing surface, the safer we're going to be. Now, larger playing areas and surfaces, such as athletic fields and tracks that have multiple courts or playing areas, may be used by one group at at one time. Now, we talked about this before. If you have a full-sized field and you have teams that normally play 7v7, which is, I believe it's the U12s, no, sorry, the U10s, correct? U10s, and or the grades 5 and 6, U10s, that you can have 4 7v7 pitches on a full-sized field. So you're limited on 25 players and coaches to each of those 7v7 fields for practices. You have to have a 20-foot buffer still while sharing a single playing surface. So you cannot parse that field. You can't put U15s or high school age in 7v7s and try and get 100 high school age kids on one full-size field playing 7v7, because that is not their normal playing surface. So you could also do 2 7v7s on one half of a field and 1 9v9 on the other half of the field, as long as the players that typically play 7v7 are on those and the 9v9s are on that. So you can't take the oldest groups and push them down into smaller surfaces and try and max out the number of kids per field. And once again, everything must be 20 feet apart. So now that we're in competitions, we've got the 100-person rule kicking in. So no more than 100 people, including participants, players, coaches, volunteers, spectators, in aggregate, in, on, or around any playing surface at one time. This is provided there's adequate space for all participants to maintain 6 feet of social distance at all times, recognizing that for some moderate risk sports, intermittent contact may occur for players. So folks, is 100. So let's look at that a little bit deeper. For the purposes of competition games, the surface or playing area is a full-sized soccer field. That's the way the EEA took it out of it. What is a full-size soccer field, or what is a full-size basketball court, or a tennis court, or an ice hockey rink, or a lacrosse field, or a field hockey field? And it's no more than 100 people, as described, may be on and surround a full-size soccer field. So we're limited to 25 per playing surface. So if we have a 11v11 game going on, you've got 11 players on each team, that's 22. And then let's say you have a full complement of referees. You've got a center and 2 ARs, that's 25. They're on the playing surface. We're fine. If you have 3 subs, 5 subs, 6 subs, 2 coaches, as long as everybody on the sidelines is not on the surface, spaced 6 feet apart, you add them up. And so let's say on the sidelines, you have 5 subs on each team, you have 2 coaches, that's 12. So 25 plus 12 is up to 37. Now you have room for 63 other people to be around that playing area. That comes up to your 100. So we do not count people on the sideline as a part of the 25 on the playing surface. So you got your playing surface, you got everybody outside, add them up to get to your 100. If a full-size field's parsed into 2 9v9 fields or into 4 7v7 configurations, the max is still 100 around this entire playing surface. So you're going to need to keep track of that, because it doesn't mean you can squeeze 400 people around 4 7v7 configurations on a full-size field. So it's 100 for a full-size field, no matter any way you have it parsed up. Now, if there are multiple small-size fields in a common area, for example, there are many towns that don't have a full-size field, but they could have 6, let's say, 7v7 fields in a big field. Well, you take those 6 7v7 fields 4 of those would make up one full-size field. The other 2 would be a part of another full-sized field. So for that entire configuration, you can have up to 200 people. 100 for the 4 77s, and the other 2 77s, which possibly could be a part of what would be a full-size field, make up another field, and they could have 100. I doubt very much that, with a 77s with all 6 fields going, that you're going to get close to that many people based on some of our recommendations that will be coming. The object, folks, is to limit the number of spectators. Spectators must wear facial coverings and maintain 6 feet of social distance at all times. Unless, of course, family units can stay within 6 feet, but facial coverings or masks, must be worn at all times while out observing soccer activities. Also, coaches, staff, referees, and other officials, such as directors or board members that are out and about, are required to wear facial coverings and maintain social distance of 6 feet at all times. So we understand that there is some concern from the referee community, me being one, about wearing a mask while performing my duties. Just like we were working real hard on getting soccer reclassified, we are also now working with the other sports to have referees, basically, especially those that run during their duties, to be classified as what would be considered an athlete, not a player, but an athlete, and that wearing a mask is detrimental to their health and well-being while physically exerting themselves. And so we're trying to work on this. What may end up happening is that if, for now, a referee must wear a mask while reffing a game, and because of wearing a mask, we'll need to use an electronic whistle. It's not going to be one of the situations where they're wearing a mask, such as this, and then they're pulling it down to blow the whistle and putting it back up, and then it falls off, it breaks, it snaps. Whether it's a face mask or a neck gaiter, electronic whistle is going to be the preferred instrument of use. We understand that there is a backlog or a back order of electronic whistles. The manufacturers are doing their best, but the nice thing about an electronic whistle compared to a manual whistle is it can be shared. If a referee is doing a game, uses their electronic whistle, gets a wipe or sprays it down, disinfects it, they can hand it to another referee to do a game after. So, so members can get a short supply and have a coordinator at the fields just make sure that the electronic whistles are there and nobody walks home with them if it's one that's going to be shared. So as long as it's sanitized, it's okay to share and be used by others. But that's what we're trying to do is if we can get the face coverings eliminated for referees, the referees will still need to maintain 6 foot distance. It's also possible they may not have to wear a face mask or face covering, but they'll still have to use electronic whistle because of the concern with regards to blowing a whistle and spittle coming out of the whistle, especially even 6 feet away on a windy day. The preference is electronic whistles. Also new is if a parent prefers that their child wear a mask during games or practices permitting contact, is to make sure the mask is not considered dangerous equipment under the laws of the game. A mask or face covering, such as a neck gaiter, I'll slip it on here, that wraps around the neck can be considered dangerous equipment because if 2 players get close, somebody falls, their finger gets stuck in it, they're going to choke somebody. So a mask that fits over the ears only will be considered safe to wear. Because if a child gets a finger in here and it pulls it off, the mask will come off, and most likely one of the bands will break and off comes the mask, but nobody's hurt. So a parent can request that their child wear a mask that goes over the ears, and that is permissible and will not be considered dangerous equipment under Mass Youth Soccer guidance. So what has changed or not changed? What takes place on the field is all that's changed, folks. Practices and games, the numbers, games can now be played. Practices can have closer than 6 feet, even though we prefer it not be as much as possible. But there's been no change at all, no change pretty much at all to all the guidelines pertaining to off-field activities. People arriving, keeping their distance, wearing a mask from their car to and from, single file, keeping separation, everybody wearing a mask going by each other, 6 feet of separation when watching games, sanitizing equipment after the child's had a practice or a game, wiping everything down, immediately leaving the complex after a practice and game and not hanging around and socializing. All pre-practice game player checks, arrival, walking the fields, none of that has changed. All that's really has changed is we can now play games and we can have practices that that allow closer proximity, but that's it. Everything else has not changed. So now I'm going to go into a list of what I consider important considerations that we need to keep in mind here. So number one, contact drills. That's in level 2. Contact drills are permitted. Folks, soccer should not conduct contact drills. Now, contact can come into play when you're practicing, as a part of your exercises, where shoulder-to-shoulder contact is going to come into play to try and challenge and steal the ball. See, the only deliberate permissible contact in the game is shoulder-to-shoulder on a fair challenge when the ball is in play. Otherwise, it's a foul, charging. So I don't know of anybody that goes out and practices charging with their teams, or I hope not, for that matter. So we really do not want to focus on contact drills at all. There's no need for it. Do not conduct any practices that focuses on shoulder-to-shoulder challenges. When things return to the game being more normalized, probably this winter and next spring, yes, you can start conducting practices that involve more challenging, and shoulder-to-shoulder. But for right now, please don't conduct any exercises that involve deliberate shoulder-to-shoulder, technique. Now's not the time. We're trying to make sure that we keep contact out of the sport as much as possible. And practices should include as much distance as possible when you're holding your practices, as I stated earlier. Now the question has come up, and I want to first off thank everybody who's been submitting questions ahead of time. If it wasn't for some of the questions that have been rolling in over the last several days, at least since we announced the webinar, I would have half as much content. So a lot of the slides we have are basically geared towards a lot of questions we got. We were fortunate enough that the EEA has basically reclassified soccer down to moderate risk and has not imposed any modifications. However, if a town, a club, or a league feels the need to further reduce risk, make modifications to the game, that's entirely up to them. Next slide will cover some of those. It's also possible that a town or a city department or board of health could require these actions. They could ask the league, or they could ask the town or club to try and limit contact as much as possible from conducting games, when conducting games and practices. So here's some possible things to talk about, some considerations, is to suspend certain actions for this season that mitigate contact. For example, we have no heading at U12 and lower. Let's just do no heading for this season altogether at all age groups. especially the older age groups, when the players go up for heading, there's often a very close bodily contact challenge. Let's think about possibly reducing or eliminating that. That's a town club league call, not a Master soccer call. Slide tackling. Many leagues or clubs already automatically have eliminated slide tackling, especially on in-town recreational programs. So, but that's something to consider, is to eliminate slide tackling, because even though a slide tackle could be a clean tackle, there is the potential for contact after the ball has been contacted and a player falling on another player. You can consider suspending shoulder-to-shoulder challenges altogether. So it's not to say that players can't get close and practice blocking, whether it's a toe poke or using their boot to block a pass or a dribble, but is to consider no shoulder to shoulder. And then some other modifications that have been used around the country by some other states is throw-ins. Rather than using a throw-in, they use a free kick-in or a dribble-in. That, you know, it's basically, it's how we teach the young kids, the U5s, U6s, is put the ball on the sideline and they get a free dribble in, and then the other teams, you know, the other team has to stay either 8 feet away or 8 yards away or 10 yards away, just like a free kick. And they can dribble in, and then it's a live ball, or free kick in to be received by another player, and it's a live ball. And most of the time, the free kick in should go either equal or behind the direction the team's attacking. And same thing with the corner kick, is to treat it like a throw-in, you know, is to not use a corner kick that's lofted into the air that forces players to get close together and challenge, but use the free kick and or dribble in as well for corner kicks. So these are some potential game modifications that you might want to make. There are also game modifications that your local Board of Health may ask you to make to at least give you the ability to play the game, because they might say, no, we just don't like it the way it is. Go back to practicing from 6 feet apart until we feel more comfortable. So there are ways to make some modifications. Now, for the purposes of practice and competitions games, we suggest is that you limit your spectators to 1 parent, guardian, or chaperone per player. Chaperone typically is an older sibling who drives them there, or a close friend, but try and limit spectators at games and practices to just 1 per player. There's no reason or no need at this point of where we're at to have 6 people in a family come out to watch, 1 player play. So let's try and do that. That would help out tremendously. A league has the ability to actually require that, but we're just highly recommending it and suggesting it. Also ask that grandparents not attend unless they are the player's guardian or chaperone. So it's very, with everything going on, I think, as everybody understands, is that those that are in, I guess, in my age and above, and a little bit below, are considered a risk class. So no grandparents should be attending. Let's keep them safe as much as possible. Let's keep kids away from them, especially since they'll be out and about, and not have them come home and make sure they keep their distance as much as possible away from grandparents while they're involved in these activities. But of course, if the grandparent is a guardian or chaperone, they're permitted to be there. If need be, to accommodate spectators, you can use the areas around the field other than just the spectator side. We understand that at a lot of fields, space is at a premium. You could have a touch line right up against a fence. And so when you start spacing everybody 6 feet apart, you're going to run out of space. So during this period, it's totally okay. I know we're not supposed to have any spectators behind the goal lines, but for now, we will permit spectators behind goal lines. Of course, try and keep them at least 3 to 6 yards away from the goal line, not crowding the net, and of course, make sure they're quiet and so they're not harassing any goalies. But that's going to be permissible. And even if you have to start creeping around the sides of where the team benches are to accommodate, as long as they're not close to the teams, that's perfectly okay. So these are things that we're going to have to start to do to fit people into the space that we have. Please make sure that this is communicated to the coaches, parents, and referees in a league-by-league basis or within the town, because we have a lot of referees who still, which are doing phenomenal jobs and will not let people sit at the end of goal lines, and they won't start a game until that's taken care of. So we need to make sure that all of our assigners get this information out to everybody, all the referees. Scheduling practices. Make sure to pre-schedule all activities. We cannot have too many teams or players on a single location unannounced. If you've got a practice field, you cannot make it first come, first serve. That will not fly. That basically violates state guidelines and such. We can't have that take place. So everything needs to be pre-scheduled. I think we've all gotten used to it now with any time we go to, whether it's to a restaurant to eat or to any place that typically would take walk-ins. Walk-ins don't take place anymore. Everything needs to be reserved ahead of time, including soccer activities. So make sure to pre-schedule all activities and that you follow the number limit guidelines. That's so very important. No pickup type play is permitted. You can't just say, okay, on Friday night at 5:30 at field ABC, all U12s can show up. That is not going to take place. The whole thing is that we need to limit all of our activities team-based across the board. Team-based. So that multiple teams aren't mixed together. Why? For tracing purposes. That's so important. Scheduling games. As much as possible, and we know it can be difficult given the number of teams that you have, but as much as possible, keep groups to 4 teams for a 6-game schedule, or 6 teams max for an 8-game schedule. This is a home and away format type of play. Try your best to limit the sizes. Our preference is 4 teams for a 6-game schedule. And hey, what if 2 teams have to play each other 3 times, or they have to play each other 3 times to get 8 games? That's perfectly fine. Perfectly fine. The fall season is basically, well, one of our recommendations is not here, is don't even keep standings this fall. This is just to get the kids out playing the game, to get them physically active, to help with their physical and mental well-being. This is not Division I U10 tryout phase. So let's keep the game to what the game should be, a game. Keep it fun. And reduce the sizes. As much as possible, limit travel distances for each group. Now, we fully understand that when you take a look at a geographic makeup, that, if you've got one of our town-based leagues, and of course, you're going to have all your outer perimeter border towns and then your central towns. Well, the central towns can really, truly limit their travel, whereas the outside border towns cannot. So as much as possible, try and limit travel distances for each group. That would help out tremendously. For our club-based programs, they've done a super job over the past few years of regionalizing play. And we applaud them for doing that, to try and limit them as much travel as possible, especially in the lower divisions. Now, of course, always in the higher divisions of play, that there's going to be more travel involved because the teams there's not as many. But at those levels, it's typically the older age groups, and the kids understand, and they're being taught the importance of all of the guidelines. The above purpose for all this is to limit the spread and to facilitate tracing if needed. Another consideration, folks, people are always asking, well, who's responsible for the parents and the spectators? Coaches have always been responsible for the actions of their parents, players, and spectators. This does not change. The coach is responsible for what their spectators or parents are doing on the opposite side or around the field. Just like if a referee has an issue with a parent, the referee is supposed to go to the coach and ask the coach to address the parent. That's the process that should be used. Now, if a COVID safety officer or a COVID coordinator has an issue with a parent or a spectator, that coach is to go over and address that parent. The COVID coordinator, of course, for every team is there to help. And that should, that should be communicated to every parent, that every team will have a COVID coordinator and that they will be out there to make sure that their duties, can be taken seriously. At the end of this slide presentation, at the very end, we're going to go into the duties of a COVID safety officer and the coordinator. Another important item is attendance must be kept for all activities, practices, games. Attendance must always be kept. A couple of reminders, we went through it the last time, is that if your program, if your club, if your town has not updated the registration language, there is waiver template language found in the member toolkit website under administration tab. Please make sure that that is started to be included because it includes specific language with regards to COVID-19. A lot of questions with regards to PPE. So the basics of PPE are face coverings and masks, disinfectant wipes, which are difficult to get at times, or to replace that disinfectant spray and paper towel in place of a disinfectant wipe, and sanitizer. These are coach, program, facility must-haves. And so every organization is responsible for making sure that their volunteers and coaches, administrators, have the proper PPE. Now, I did talk about, actually, I'll talk about gloves are optional. There's some people that weigh in that gloves should or should not be used. The key is gloves are really only to be used for a very short period of time. Because if a glove is being worn by somebody and they just go like that through the nose, then the glove is no good anymore. And then they can't sanitize, you can, but it's really not proper to sanitize the glove. But the gloves can be worn by the coach when disinfecting balls after a practice. Put the gloves on, spray everything down, and then after finishes that, basically you take the wipes, put it in the hand, pull the glove out over it, and dispose of the glove properly, and you're all set. But they're optional. Sanitizing, washing hands is the best. Sanitizing is second best, but that should be done after any time an adult or a player touches anything that has been shared and or public facing. Sanitizer, we're just starting to get the first shipment in. I mentioned last time that Mass Youth Soccer was able to secure a donation to purchase 10,000 4-ounce bottles of sanitizer. We will be starting the packaging up of these and distributing these to all of the leagues throughout the state. We have one central person per league that will deliver to. We're using the fall registration numbers from last fall that we received at Mass Youth Soccer. Yes, there were some organizations that were defunct in getting us that data until just recently, but they'll be included, is that we'll send one 4-ounce bottle of sanitizer for every 15 players registered. So that's kind of a starter set. We were able to get a $25,000 donation to take care of this. And we'll be getting this out to everybody shortly. We're starting to package and we'll be bringing it to key individuals at every league. And then from there, the towns or the clubs can pick up from that central league person from there. We started this process before we were introduced to our friends at Gloucester Bio. And that order already consummated. They already started putting up the labels, and then we found our friends at Gloucester Bio. And I will tell you this much, the 4-ounce bottles for $1.99 are about 50 cents less than what we did with ours. So this is pricing you won't find anywhere else. The product is fantastic. They've got 4-ounce, 8-ounce, 16-ounce bottles. And in addition, you can always contact them because they have access to the automatic dispensers, as well as some other sanitizer dispensing equipment. So you can go with a gallon. They've got that, but their pricing is incredible. The 50% off is for the bulk pricing by an organization. And then if a family wants to buy it or a coach wants to buy it for a team, on his own or her own, they get a 25% off rate from their standard rate. So the product is fantastic, and I just would love to just give a call out to our folks at Gloucester Bio and stay wicked clean, as their slogan goes. This information is also on our website on the Return to Soccer Activities resource section. We're getting a lot of questions with regards to taking temperatures, and parents are to self-certify that their child is illness-free. Okay? That means, has the child been running a temperature? If not, fine. Has the child been exposed to anybody in the last 14 days? Has the child showed any symptoms? That is the parent's process. The parent has to self-certify. All of this information is in our guidelines in the parent section. The parent takes the temperature, not the coach. And there's a lot of various reasons for it. And yes, we have contactless, thermometers that we can use that shoot on the forehead and such. But the second a coach takes a player's temperature, whether the temperature is recorded or not, it technically is retained. Up in the brain is retained. We do not want to retain any personal medical information about a child, as this may violate health information privacy policies. So there's a combination of what's health information privacy policies as well as HIPAA. Certain organizations are able to take temperatures because of how they operate. But folks, it's possible that we could be in the okay doing this, but our concern is that who knows? We've got 330 member organizations, 20-something thousand adults and coaches, and we could end up with more false positives, that alarm bells and everything start going off, that it's not worth the risk. The parent is supposed to make sure that their child is healthy and can answer those questions about the standard COVID questions about being in contact before having their child attend. Now, is it possible that a parent might just say, forget about it, my child's fine, and in goes the child? Yes, it is. It's the coach's authority and right to say if they feel that a child looks ill, looks feverish, is having a problem breathing, the coach can automatically tell the child, that's it, you're done, go find the parent, find the guardian, and go home. They have the authority to do that. They've always had the authority to not let a child play if they were ill or injured. And so there's really no difference. Talking about the coach. Folks, the coach is the key. The coach is the key. When it comes down to it, the team coach is the key to our success. Successful communication from the organization or league to the players and parents may be direct, but the coach is the key to supporting your message as a leader in your organization. The success of us complying with the guidelines is with our coaches. They need to understand their roles. I've been talking to some physicians, I've been talking to some people who understand some of the risk that's involved. And as we know, schools are constantly reevaluating what's going to be taking place. And one of the biggest concerns within schools is the adult teacher. We have the same amount of concern with our adult coach. The coach has to understand all of the guidelines, the protocols, the policies, the rules, and they must abide by them. They're setting the example for everybody else. Coaches, with the support of the club COVID-19 safety officer and team coordinator, must understand, implement, follow, and support all of the guidelines. They need to set an example for the players, the parents, spectators, and the referee. We're asking that they must maintain 6 to 10 feet of distancing at all times. So when it comes to a practice and the coach wants to demonstrate a certain skill, have the coach demonstrate it to, just to make pretend friend next to them, but not to another player. The best is to identify a player on the team who understands this skill and have that player demonstrate that maneuver or that technique. But the coach, 6 to 10 feet away at all times, at all times. The only time a coach is really going to be permissible to have any contact with the player is if there's an injury. The coach will already have their mask on because it's required at all times. And if they go over to attend to an injured player, the coach is permitted to go attend to the player, take care of what needs to be done, and then afterwards immediately sanitizing using hand sanitizer at the field, making sure to never touch the player in the face, in the mouth, anywhere along those lines. If it's a matter of lifting them up, holding their hand, that when you get to the sidelines, proper hygiene and sanitation must be followed by both the player and the coach. So be very careful. If there is an injury, we typically don't let parents come out onto a field. But if there's a parent there that wants to come on out, we have to be a little bit more flexible this time around and let the parent go to their child. But the second the child comes back into play, they're going to have to sanitize their hands and be prepared. We get quite a few of these questions. So what if a member of an organization contracts COVID-19? You're going to see a common theme through everything, and it's called the Board of Health, the Department of Health, the local health authority. Affected individual or parent should contact the president and the COVID-19 safety officer of the organization, who then contacts the Department of Public Health. I will tell you this, that if somebody is identified as being COVID-19 positive, the Department of Health will get in touch with that organization much quicker than the president or COVID safety officer getting the word from that person and then contacting them. The Department of Public Health or the local Board of Health in the city or town or community will provide the individual with instructions on what to do. Do not make up these steps on your own. Follow their guidance. They've got this down to a science, or the process is down. All parties who have had close contact with the individual should be notified using the COVID diagnosis notification form, which is found on the resource section of the Mastery Soccer Return to Soccer Activities page on our website. I'll bring that page up later on and show you where that resides. It's important you do not disclose the individual's name. All teams and individuals that came into close contact with the individual will have soccer activities suspended for 14 days. And let's define close contact. And by the way, the definition of close contact for somebody who's been COVID positive has a lot to do with why certain sports are considered low, medium, and higher risk. Because close contact is someone with whom you have been within 6 feet of for at least 10 to 15 minutes while symptomatic or within 48 hours before symptom onset. So close contact does not mean somebody who is walking into a facility with a mask on passes somebody who is walking out of a facility with a mask on. That is, by the DPH, Department of Public Health, is not considered close contact. They've been within 6 feet for at least 10 to 15 minutes. That is what they use for tracing purposes. The close contact can also be somebody who had direct contact with the droplets of a COVID-19 case being coughed on while not wearing a mask or face covering. So if in fact the amount of time that you've been around somebody is less than 10 to 15 minutes, that's only a minute. But if, yes, that person did cough, didn't cover their cough, and then all of a sudden they're tested positive, then they'll be considered having had close contact. So once again, if you have any child or adult for that matter who shows up to a soccer activity and has a cough, immediately send them home. Immediately send them home. Now, yes, we have allergies, which I have, and there's sore throat or dry throat, or you have a temporary tickle. But you can tell when somebody has a persistent cough that could be attributed to an illness, but don't take any chances for sure. Be prepared to provide the local health officials with information regarding those who have had close contact with the individual. This is why the attendance is so very important. Accurate attendance for each session is a must. So let's make sure that we maintain that at all times. Getting to the end here, a couple of things I want to hit on. The Commonwealth of Massachusetts. The Lieutenant Governor and Governor have stated in prior press conferences that all youth sports will be reviewed at the end of this summer as to what is permitted in the fall. Now, what came out under the guidance from the state is that organized youth and adult sports are permitted, under the phase 3, step 1, levels 1, 2, and 3, or 1 only, and that they've also are taking a look at school-related, kindergarten through 12, K through 12, as well as other youth sport activities. They're not together, they're separate. Anything having to do with schools, anything having to do with MIAA is not under these guidances. They are separate. The Department of Education is separate from the guidances that are coming out, which is why you're hearing a lot about MIAA, and it does not relate to youth sports, and that's by design, because MIAA, high school sports, have so many other considerations to take into consideration as compared to our youth sports. We must take our responsibilities with a high measure of seriousness. Just because we can play games now does not mean we just go out there and let everything go, just willy-nilly. Let's do everything possible to be a part of the solution, to be a part of the mitigation, to be a part of, making sure that we're eliminating as much contact, if any at all. Let's wear the masks at every opportunity that they're supposed to be worn. And I want to make it clear that I've talked to a few people, and already local departments of health or boards of health have told certain organizations, different sports, that they're going to be more stricter than what the state provides. And they have authority to do this. Don't argue with them. Find a way to work with them. Thus, the suggested modifications that we made earlier on. The local Department of Board of Health can make things a lot more stricter. They have the authority to do that. So open up your lines of communication with them. This was a part of the blast that went out. I just put it up here. I want to repeat this, that, even though it's exciting that soccer is now been reclassified, we can't stress enough the importance of the responsibilities that we have to our children and all the families involved in our sport for their health, safety, and well-being. We were given a privilege. And we must stay true to our word that we will follow the CDC, follow the State Department of Public Health, follow U.S. Soccer, follow local guidelines in everything that we do. And we should hold each other accountable to that, for sure. Now, Mass Youth Soccer understands the broad spectrum of risks that our members represent. Believe me, I've been getting the emails, and they run the gamut. And I respect and I understand the position that everybody's taking. And I've had some great dialogue with people expressing their concerns, their positions, their interpretations. And I think it's fantastic that we can have these conversations, and I encourage this. So we at Mass Youth Soccer understand that there's a broad spectrum. We want to make sure that everybody understands that it's a player's parent or guardian. They have the final say regarding their child's participation. They may decide not to have their child participate this fall or through the winter or possibly into the spring. And if that's their decision, that's perfectly okay. We need to respect the parent's decision. Please, no judging, no retaliation by moving them to a different team or moving them down come springtime or taking them off the roster altogether. No adverse actions at all, please. This is now not the time to be vengeful, to judge. Now is the time to respect everybody's decision about what they're making for the health and well-being of their child. So I really, really hope that I don't get any of these complaints up to our office. Mass Youth Soccer will continuously assess the current environment. We're taking a look at numbers every day that we get from the state. I'm in contact with people at the state DPH. We're following everything closely. We're following what every state around us is doing, as well as states that are in the hotspots, the surgings, the spikes. Some states have already turned back. They've already gone from a phase 3 to a phase 2, or a phase 4 to a 3, or a phase A to a phase 0. Mass Youth Soccer is continuously looking at this. We will decide to reverse course if we feel it is necessary for the safety of all involved. And this could be prior to the state taking action. If we feel that we see negative results, that we are possibly contributing to negative results, we will do everything possible to mitigate, and if we need to, we will reverse if we have to. I showed this last presentation again, is that we need to adhere to the guidelines. It's imperative we follow the guidelines. So identify your organization's COVID safety officer. Each team should have a COVID coordinator. All coaches, volunteers, employees must read, understand, and practice the guidelines, folks. This is a group effort, and together we'll do okay. We'll do great. I am so proud of everybody that supports the game of soccer in the state of Massachusetts. From the new child just starting at U4 and the parent who's never played the game before, but has volunteered to coach at that level and moves all the way up to the highest level of play that we have in the state. With the kids that are playing on the academy level play and the ODP level play and the Revs level play. Everywhere in between, we are so proud of what everybody has been doing up to this point. Please, please, let's not make soccer be the reason why the state decides to reverse direction. I love all the other sports involved, but let it be them and not us. Follow the guidelines. Commit to safety and health and well-being. Don't take our responsibilities lightly. Hold each other accountable. If we do all of this, I really believe that we'll come through a successful fall season with those children that's parents that decided to permit them to play. And we will not contribute to the negative results in the state of Massachusetts. Everything that we do will be positive, and I know we have the people to get that done. So talking about the people that will help get that done is our COVID safety officer and team coordinator. I'm going to go through these quickly out of respect for time. This information's all up on our website on the Return to Soccer Activities page. COVID safety officer, primary responsibilities, communicate the policies to everybody organization-wide. Every club or town and league should have a COVID safety officer. They assist in assigning each team a COVID coordinator to oversee compliance at the team level. It can be a team parent, it can be a coach. Whoever it is, that coordinator must register as an adult with Mass Youth Soccer. We look to them to train and educate the volunteers on return to soccer activity protocols. All of their training materials are on our website. They're in the guidelines and they're in the checklists, which have all been updated for the latest phase, and levels that we're in. The COVID safety officer is the person, whether it's the president, the COVID safety officer, or both, is to develop that relationship with the local health department officials. We talked about this before, and we say now, know what the risk tolerance level is of your local Department of Health, so you know what you're going to be dealing with. What we have heard from many people is take the guidelines, print out the checklist, get all that information, and bring it to them to show them what soccer is doing. I can virtually, guarantee or take some bets on the other sports that are not as prepared as we are here in the state of Massachusetts. Develop a plan to communicate with the local health department in the event of a confirmed COVID case within a team. They have this all spelled out. They'll tell you exactly what to do. I see people that are raising their hands, and we're not using that function tonight. We appreciate it. If you have a question, please put it in QA. So this is just a screenshot of the web page for Return to Soccer Activities. And you'll see down below is the member organization COVID safety officer information. And then on the right is all of the resources that are available on the Return to Soccer Activities webpage. And if you take a look up at the top under resources, you'll see COVID-19 diagnosis notification form, which I mentioned that if somebody does test positive is to use that form to notify the parents of players on the team. The coordinator may be a coach that takes on this role. It's perfectly fine. If they would like to do that, they'll be responsible for communicating, or it could be a parent who must be registered with Mass Youth Soccer. They'll communicate the COVID-19 policies within the team. They'll talk about what, masks and balls and hand sanitizer and social distancing. They will be responsible for helping the team, the parents, the spectators understand what the policies and guidelines are. They'll also help the coach keep accurate attendance records for practices and games. So they could be there to assist the coach with this. If the coach is, sometimes if it's just one coach per team, that coordinator will come in handy when it comes to the COVID-19 responsibilities. And they'll help monitor the sidelines to ensure that the policies are being followed. So yes, could the COVID coordinator start to become called the COVID cop or whatever it is they get called? They're going to be needed to help make sure that sideline activity is adhered to. And finally, what I like to end with this, before we get into the Q&A, is that in late September 17th, that's a Thursday through Sunday, we're going to dedicate 4 days as a tribute to essential workers. We had a contest that we put out there for some of our youth members to design a t-shirt and to design a patch. And so there's the winning t-shirt that was put together, incredible work that was done there, as well as the patch that we will be putting together. We'll be using a vendor that we've used, Northeast Apparel. Blue Huron they've been with us for 13, 14 years. And so what we're going to do is that we're going to be selling the t-shirts and patches, and all of the proceeds that we raise from the t-shirts and patches And as we celebrate our essential workers on 17th and 13th, all of the proceeds will go towards Project Bread here in Massachusetts. So we're pretty excited about getting everybody involved. So we'll get some more flyers out, more social media will come out, ordering processes, everything's going to be introduced. And we can't think of a better way when we're out on the fields during that weekend to have all of our players, parents, volunteers wearing their T-shirt and you know, using their patch and having the patch put on their bag or on a jacket or whatever, or just clipped onto anything. We're so excited to be able to join everybody statewide in paying tribute to those that are helping to keep us safe at all times. So, not bad, an hour and 12 minutes, or give or take. And once again, for those people raising your hand, your arm's going to get tired because we are using the Q&A section. Rob, I assume we got a few questions.
Yes, plenty. So I'm going to try and group them. Apologies if we don't answer your question directly, but many of them are duplicative. We'll start off with MIAA. We're receiving lots of questions around Mass Youth Soccer's jurisdiction of high school play, summer programs. Will there be a high school season? So if you could clarify what the relationship with the MIAA is,
Okay.
that would be great.
So the MIA, our relationship with them is healthy, but our connectivity, we're not connected. The MIAA is their own organization, and they oversee and they govern all scholastic play, specifically really at the high school level or sometimes the 8th grade and higher. And they've got a whole litany of issues that they need to be concerned about with their return to play. As you know, they first, for the fall, put an extension to the middle of September. Purpose of that was to see how returning to school for the first 2 weeks of September was going to be handled. Whether it's everybody's back in a school, or it's blended learning, or it's all virtual, or the such, is that they wanted to take a look at that. Then, as we know, is that recently many school districts under some guidance from the MTA has pretty much asked, let's delay the start for 2 weeks in September so that we can get our self in order, we can be properly trained, we can have proper PPE available and everything that can be coordinated. Some schools have even decided not to stall. Some elementary schools mostly have, and school districts have decided to put it off until October 1st until they go back to a blended learning. What they're hoping for is that after kids finish the summer and they get back into virtual classrooms, is that will also help kids to isolate and quarantine during those weeks in September after being out and about in the neighborhood with friends during July and August. So they're kind of looking at that time frame to help with the quarantining so that if they do go back, that they'll be able to manage things better. Now, if there's no high school, if the high school season is now deferred until the month of October and the first week of November, where they can get some games in, that's great. We are supporting some summer leagues that are affiliated with us to have a summer schedule. But we're making sure that those leagues that have high school teams and or high school age club teams competing, over the next few weeks into September, follow our guidelines. Now, keep in mind, Mass Youth Soccer does not oversee, sanction, and all high school soccer activities in the state. So we can only control what we can control. But what I can say is virtually all of the clubs and towns that are participating, are using our content. So the folks, not only at the town-based leagues, but the CCLNE, the EDP, the NECSL, and the NEP are on these presentations, have watched, and they're using our content. But high school soccer, summer play or extended summer play is not always under our umbrella.
Thank you. Next one, in regards to masks, can you provide some insight as to why soccer players are not required to wear masks when there may be intermittent contact closer than 6 feet.
Okay, absolutely. Let me, bear with me a second. So here is the amended July 24th announcement. Rob, can you see that okay? Great, thank you. All right, so if we scroll on down to this section about the question about masks, and it's gonna be, bear with me while I work this, it's a little fidgety right now, is that there is under the guidelines, a section on the wearing of masks. Make sure I don't go by it, Rob, here. Here we go. Oh, no, this one purchase, that's not it.
Second bullet point there, face covering.
This one right here, right? Yep, this one right here. So this is the bullet that some people have pointed out to us right here. And if you notice, it reads, is that facial coverings be worn while engaged in moderate risk sport activity where intermittent contact might occur. And that really should read, if it is safe and it is safe to do so. Well, we have seen a lot of research. The Aspen Institute put a report out. Several major medical institutions and universities have done some studies. And what they've come up with is that for many sports, wearing a face mask is actually more dangerous to the athlete than the risk of exposure is. In heavy exertion sports and activities, wearing a face mask could limit oxygen intake. And so where it says it's safe to do so, now in practices or the such, we're asking 6 feet of separation as much as possible, and a mask need not be worn. And when there's close, the other is, the definition of contact, a point of contact was within 6 feet for 10 to 15 minutes. And so we know that players are not in that other player's space for that long. Now, yes, is there a risk involved? Is there the opportunity for particle spread, transmission, respiratory particle? Yes, there is. But our view of this is that out of the health and safety for our soccer players, that we don't require them to be worn. Now, a member organization may want to take that a step further and require, possibly at the younger ages where there's not as much physical exertion and they would like the children to wear a mask, that's okay. A club for in-town or intramural or academy play, in-town play, they can require it. That's okay. Our organizations, our members can be more stricter if they would like. But as we take a look at the higher levels of play and the true travel levels of play, that it's the studies that we've been provided with lead us to believe that the wearing a mask is basically not healthy, and so of course the decision from a parent is a parent could say, listen, I don't want to take the risk, and that's fine, we understand it. Nope, you're on mute, Rob.
Thank you. Some related questions. Can coaches wear neck gaiters?
Yes, they can, because they're never going to be within 6 to 10 feet of a player, so there's no possibility for that to be yanked off their neck. So absolutely, they can wear neck gaiters, yes.
And some clarification on masks for players. They must be tied behind the ears.
Correct. Nothing that ties around the head or the neck and head, because if a player accidentally comes into contact and the finger gets into it, it's just the same rule we have for jewelry, for necklaces, that it could cause damage to that player. Thus, if a child is going to play with the mask on, make sure mom and dad buys a box of 50. Because 10 to 1, what's going to happen is they'll fall on the ground more than they'll get put off the face, because a child most likely go through a whole season and never get a hand in the face.
Thank you. Mask requirement for spectators on the sidelines. They appear to be more stringent than the state recommendations, which state that they wouldn't have to wear them if they were socially distanced on the sideline. Can you provide some insight into both why we've made that recommendation and how you would recommend we enforce those for town and club associations?
Right. So there was a lot of discussion amongst those of us at Matthews Soccer as we took a look at this. And it comes down to, basically it comes down to assisting our COVID safety officer and of course out on the fields, our COVID coordinators. Is that we have felt that number one, it's the safest thing to do is to require the masks at all times. And number two is that when somebody doesn't have a mask and all of a sudden they're going to pop up and they're going to move about and they forget it. And so we don't want to have the safety coordinator to constantly go out and catch the people who forgot it or remind them that they have to put it on or something. It's just as easy to make it real simple and consistent that everybody out there wears a mask at all time. Now, once again, there are certain people that may have health issues that negate them from having a mask on. Somebody, a parent may have respiratory issues along these lines, and as long as they're able to provide the guidance and proof that that's the case, then of course they don't need to wear them. But that's the position we've taken.
Lots of questions regarding game modifications and recommendations to reduce risk, particularly differences between training and games. Can you explain why we're recommending kick-ins, dribble-ins in practices or in-town games when they would be allowed perhaps in regular league games or play?
So if an organization modifies their game rules, then that would just bleed right down into practices. So if you want to have a practice if you decided to limit throw-ins or suspend them for the season, well, you wouldn't be practicing throw-ins in a practice. So, basically what happens is any modification is made is applicable to any time we're out on the field with the kids.
For clarification purposes, the game of soccer with throw-ins, corners, that is classified as moderate risk and players are able to play the full game without modifications.
That's correct. But if a local Department of Health wants to limit things, wants to restrict, that may be your only opportunity to get kids out on the field is to play a modified game. So we're not suggesting everybody goes out and modifies, but it's available in the event the local Department of Health or Board of Health or town manager or mayor, whoever wants to get involved, says, listen, you have to wear a mask at all times. No matter what, you have to wear a mask at all times. Then you can go back and say, okay, what if we modify certain things so that we eliminate the contact, eliminate chances for close proximity? Can we then have players play without a mask? So that's when it would be used.
Related to that, if a town has different requirements than a neighboring town, would they be required to adhere to or abide by the town with the stricter guidelines?
Hometown rules always apply.
Thank you. Another question regards to the town Board of Health. Who should they be notifying if there is game changes or so on? If there's requirements from the Board of Health, should they contact their league or should it be Mass Youth Soccer?
They would contact the league. So, of course they would work it out internally for any of their in-town or internal academy play. But anytime that they're playing inter-town, whether it's through a league or friendlies, they should notify the league so they can get that information out to everybody to say, if you're traveling to ABC town, they play a modified game there, and that's just a matter of making sure that information gets across. Let me tell you something. The kids get it real quick. It's us adults who fight everything. You just tell the kids, hey, listen, it's back to kick-ins like you did at U6. Oh, well, that's cool. Let's do that. And away they go. But the coaches, oh my gosh, it's not the game. It's the way it's meant to be played. Folks, we're not in times that are normal times right now. So let's do our best to make things work the best way we can.
So moving on to contract tracing and so on. So the first question is carpooling. Is carpooling allowed under the new classification?
It has not changed from our guidelines. It is carpooling should not be conducted unless, of course, it's the only way to get a child to a practice, and then everybody in that car should be wearing a mask to and from and sanitizing.
So, if someone tests positive and notifies the soccer organization, do they notify the state or their local health department?
Local health department. Local health departments have got all of the processes in place to deal with this. They deal with it in work situations. They deal with it in their own organizations, whether it's a police department, a fire department, school department. So they've been trained, and it's under their jurisdiction. You do not you are not a self-anointed member of a health department.
Clarification on tracking of attendance. Is it just the players and coaches and referees for games, or do they need to track attendance of spectators on the sideline as well?
As long as spectators on the sideline are maintaining the 6-foot separation at all times, and they would not be considered what is considered a contact point. No, but it's so that is why at the end of a game, a child goes to a parent, they leave 6 feet apart from all others, mask on, and they depart right away. So it's really for children and adults that are participating in the game and practice.
Thank you. Question regarding positive tests again. If a player tests positive and they have a sibling who plays on another team in the program, would you also need to follow the notification process for that sibling's team?
The local Department of Health will tell you exactly what to do.
Another question regarding notification. If you have a team who plays 2 other teams, Team A plays Team B plays Team C plays Team A, one player tests positive, are all teams then required to quarantine?
You're talking about the Florida Marlins? So local Department of Health will tell you exactly what to do. And if it's a team from another town, they'll be in touch with that other town. Once things get going and the tracing process starts, they've got it under control. And so, yeah, would a friendly notification from one club or town to another, help? Absolutely would. But the DPH, the local departments of health, will take it from there.
What's Mass Youth Soccer's stance on entering teams into tournaments in other states?
So teams are permitted, teams are permitted to go to other states as long as they comply with the other states' guidelines. So right now, if a team wanted to go into a tournament up in New Hampshire, they're permissible to go up there as long as they follow all of the guidelines in the state that they're competing in. Okay, they don't have to come to quarantine because Massachusetts right now under travel restrictions does not require quarantining for all New England states, New York and New Jersey. So there have been some teams that had teams that were scheduled to go down to Maryland for tournaments and they pulled out because of the risk involved, and then the travel restrictions pulled in, so they wouldn't be permitted to do that anyway.
Thank you. Some more questions about enforcement of not following rules. If parents aren't wearing masks, what's the follow-up?
So the COVID coordinator for the team is going to go out and do their best. The coach is going to assist them. And if they have a belligerent person who decides that, no, I'm not going to wear a mask, it's my right not to, and I don't want to even get into those discussions, the next step is called 911.
Thank you. Administratively, the COVID officer, are they required to go through the Mass Youth Soccer adult registration? We have some concerns that the concussion test or the concussion course is lengthy and is putting people off.
So first off, anybody that's involved in Mass Youth Soccer activities as an adult needs to do the background check, the CORI, the concussion course, as well as the abuse prevention. So does the COVID safety officer? Yes, by taking on that role, they should. What we're finding for us is most COVID safety officers are already board members of member organizations who have met these obligations. These are state requirements and national and federal requirements for the abuse prevention training. That's a federal requirement. So yes, but they take the concussion course first off. It's gonna help educate them, number one. Number two is that it's good for 2 years.
Thank you. Question regarding spectators around the outside the field. Will we be allowed to position spectators on the end lines to be able to observe social distancing?
As I did cover in one of my slides, is yes, you can. And actually, one of the things that you really should consider doing, it's in the state guidelines, is getting a can of field paint and marking X's every. We suggest every 8 feet around, because you could have 2 people, that are family members. They could both. We recommend only 1 family member, but they could be living in the same household with 2 children out there. There's a lot of different situations. Or you could have a parent who must have a child with them in attendance as a spectator because there's no coverage for the child at home. And so, which is permissible. We're not going to tell parents to leave a 4-year-old at home by themselves. So every 8 feet is an X, and that way you can cover that 6 foot of separation.
Some clarification on the COVID team COVID safety officer. Is that person required to do all 3 trainings?
Once again, our requirement is any adult that is involved in any activities having to do with children, and on taking on a responsibility, is they do need to go through the adult registration and pass, once again, the educational courses as well as the background check. So early on, the COVID coordinator could end up being a coach or an assistant coach who has already gone through it. And then once a parent gets up to speed, they can just hand those duties over to a parent.
Thank you. Equipment question. Can the coach bring a bag of balls for the players to use at practice?
So if a coach is going to bring a bag of balls for players to use, absolutely. They should first make sure that the balls have been sanitized before they were stored, and that when the coach puts the balls out, he should take a wipe and or spray in a paper towel and wipe them clean and put them out for where the players are going to use them. And then at the end, the balls should be, he or she can put all the balls in the bag, get him home, and then sanitize everything at home and wash the bag or spray the bag with a Lysol spray. But everything must be sanitized pre and post.
Question from the administrative perspective. How are towns expected to keep track of attendance of games, referees? Who is going to be responsible for tracking the players? Who do they report it to, and so on?
So the attendance sheets, typically it's for a team, because everything is going to be team-based. It's going to be fairly easy. It's called a roster. And that at the top, you just have them keep several copies of rosters and put a date on top of when it was a practice or a game. And you got the coaches' names on the roster, that they maintain that, and they use that as their attendance sheet, with the date and the location, and that goes in their file. The coach can keep it or can be assigned to a COVID coordinator if they want that person to keep it. A lot of times, the coordinator could be a team manager, which is often a parent. And so there's these different ways to keep that information. It's and they should have it with them at all times. You know, when I mean all times, whenever in practices in a file or folder, or electronically for that matter, if they want to do it electronically. But it needs to be accessible for tracing purposes.
Thank you. Rick Paul has asked, what's the status of and usage of porta potties at fields?
So first off, the status and usage of a porta potty at a field is first it needs to comply with whatever your city or town has in the regulations for having such unit on a field or in a parking lot or the such. That's number one. Number two, it needs to be cleaned regularly. Now, regularly does not mean after every usage. Some organization has gone far to find a volunteer who will spray it down every time, handles and everything. But you should really make sure that the unit does have sanitizer inside the unit, and that if you want, you can have somebody use wipes to clean off the handle often. But technically, under the state guidance, it needs to be cleaned often, which really is at the end of every day. It should be thoroughly cleaned, disinfected for the next day's usage.
Thank you. Just some comments here. There's some really nice attendance app. People are recommending Google Forms. So lots of different ways that we can track. Mass Youth Soccer will put together some recommendations for best practice for organizations to use that as well. Keith Payne's asked a question about pennies distribution. We're strongly recommending against the use of pennies. If you can, ask players to bring 2 color tops to practice, either a white and a dark, or maybe you have a home and away jersey. We want to try and avoid any shared equipment in that process whatsoever. So
that's absolutely correct. But if I know a lot of people, especially with certain players, female players, don't feel comfortable with them having to change shirts or the such. So if you do distribute pennies, once again, the pennies must have been cleaned and disinfected prior to being laid out for everybody. And then one player gets their penny for the whole game or the whole practice. There's no sharing of pennies. And then at the end, the coach should, at that point, put on his or her gloves, collect the pennies, put them in the bag, and then take the bag home and wash it for the next time to be used. But there shouldn't be any interchange of pennies. You can assign a penny to one player for a practice as long as you collect it, take it home and disinfect it and clean it and bring it back.
Thank you. There's still a few additional questions coming in. What would be Mass Youth Soccer's threshold to pull back on playing soccer this season? Would it be based on local infection rates, reported cases within clubs?
So it'll be based on a multitude of factors and advice and information that we receive. Definitely one will be infection rates. The state Department of Public Health and the various resources that are monitoring, tracing, and measuring are incredibly able to start to identify hotspots, sources, ground zeros, and so as they do the tracing. So if we start to find out that soccer is contributing to an abnormally or a higher level, believe me, the Department of Health is going to get in touch with us right away, and they're going to have a discussion. But we'll keep an eye on that. We're also going to keep an eye on reports that we get. Ever since phase 2 started, I could probably piece together a 4-hour film reel of the YouTube postings and the video clips that people have been sending me of the good, the bad, and the ugly. And so, in this day and age, is the last thing you want to be is the post of some soccer coach, mask off, teaching a player how to slide tackle, because it'll be up on YouTube, it'll be up on Facebook, it'll be on Instagram, it'll be up before anybody knows it. And so, we're going to be tracking all social media. We're going to be tracking everything that's taking place. And if we feel that we have a problem we'll get together with medical advisors. We'll get together with people at the state, and we may make a decision. The Mass Youth Soccer Board of Directors is 100% fully supporting that if we feel that it's not safe, we're not contributing to the health and well-being, and we're actually doing the opposite, we will either reverse back to 6-foot practices and/or basically suspend activities like we did in the spring, which came from state guidance, not from us. But we could do that before we wait for the state.
Has Mass Youth Soccer designated a person for whom COVID safety officers should report to?
So internally, the person that will be managing the communications with our COVID safety officers is Tammy Endow. Tammy, manages several projects. She's a part of the technical staff team. A lot of you know her from scheduling courses and the such. So Tammy is going to be our external COVID safety officer, where communications will come from her. Now, after we've done this webinar today and we're building up our database of COVID safety officers, we'll start with communications, but she is the go-to person, and her information will be on our website.
Are hand sanitizers required anywhere else on fields and facilities besides bathrooms?
It's all listed as to where they're required under the guidelines. Facilities, not only bathrooms, it should be readily available outside the facility. Every coach should have hand sanitizer with them. It's not a bad idea for a COVID coordinator, or that could either be, some organization own their own fields, and they may find a volunteer COVID coordinator or a team of coordinators that are out there helping out as a part of facility management, not just with team, and they in turn should have access to that on themselves and/or at a central location.
Thank you. Some questions regarding younger players. Are there concerns about U10 and lower players clustering around the ball?
That's going to be a concern until we're old and gray. Do everything possible. Do everything possible to try and facilitate that from happening. And, if you find that it's difficult or impossible, we can, the technical department possibly help come up with different exercises and methods to keep them separate. But when we get to a game situation and we, basically it becomes, beehive soccer, it's try your best. And if it doesn't seem like it's possible, suspend the activities. And actually, I should also mention, talking about technical department, is that on the coach's toolkit, we have put some additional exercises and training session plans up there on the coach's toolkit on the website. So we invite you to visit there as well.
We had a question regarding communication to families, an expectation for documenting protocols. Our guidelines are fairly extensive. What I can share is we are working on some short videos, both in webinar form and using live video to help present the information in a more manageable manner. But it will still include all of the pertinent information for each of those groups, the players, the parents, administrators. So they'll be coming to you in the very near future.
Great.
What's the recommendation for retroactively having players complete waivers, many of whom have gone through the registration process already?
So a lot of the systems that we have, they don't allow somebody to re-register without having to go through the full process. Is to unfortunately, you don't want to do it in this day and age, but is to get a paper-based version of that registration form from your system and have them wet ink sign it and keep it on file.
Yeah, another option, there are DocuSign is a good example where you can sign it out and get an electronic signature directly from their email as well, if you're not willing to do the paper. We had some questions regarding the information that was shared with the state to help move soccer from a high risk to moderate risk status. Are Mass Youth Soccer able to share some of the documentation and reasoning backing the decision?
So first off, no, we don't want to share it because we don't want the other sports to figure out how we did it. No, not at all. We've been talking to the other sports regularly. Really what it came down to is it was, I wish I could take the credit for getting this done, but it was truly a team effort of educating a lot of people across the state that mobilized and got in touch with state House reps and Senate reps who were able to then get an audience with some key decision makers to try and demonstrate that soccer as compared to field hockey and as compared to no contact lacrosse really demonstrated that it was probably less susceptibility for contact than those sports and or less susceptibility for proximity of face-to-face than those sports, because even though those are no contact, when you're permitting two field hockey players to get down on the ground and challenge each other with their stick for the ball, they have a close proximity. When you have the lacrosse players, and by the way, these sports don't wear masks; they wear cages, and so there is open air. Is that with lacrosse, where they could challenge each other for the stick, having a daughter who's played lacrosse. There's a close proximity, so we tried to demonstrate that, and there was I think what we'll do is we'll put the study, Rob, up on our website from the Dutch Football Association, which did an extensive study, and it's an abbreviated version of the outcomes of the study are available. We'll put it up on our website. That helps to demonstrate the amount of time that players are within close proximity to each other and susceptibility, for transmission. It's interesting that the state defines close contact as in within 6 feet for 10 or 15 minutes. Classic examples of close contact are that booze cruise that was off the Cape last weekend. That is a violation of close proximity. Soccer players keeping their distance, once in a while getting in for a challenge and then separating is not considered close contact. So we'll put the Dutch up, and it was also the explanation and the chance for us to try and describe the whys. And the same thing, our folks in crew and sailing did the same thing to try and demonstrate. Plus, we're an outdoor sport, which then also leads a little bit towards the dissipation of the spread.
Do organizations have to produce their own guidelines demonstrating what they're doing to address state or MYS guidelines? Can they adopt Mass Youth Soccer's guidelines?
Our recommendation is adopt our guidelines and don't modify unless you want to make them stricter.
Can the self-certification process at practice be communicated by the player or parent to the coach, or do you need, can the self-certification at practice be communicated by the player to the coach, or must it be done by the parent?
So the first thing is the child should not show up if they have not passed the self-certification. So that by a parent allowing a child to come onto the field, they're attesting that they are okay to be out there based on going through the questions, the temperature check, and everything. So that's a nonverbal process. A coach is permitted to ask a child, "How are you feeling?" Without getting details about what's your temperature, or do you have a cough? It's just general questions about how you're feeling today. And if a coach feels based on observation, based on that how the child's acting, that there's the potential for illness, they should have the child stop. This should be stuff that's been practiced before COVID hit. It's bringing this importance of a coach being aware of every player's health and wellness is paramount even more today.
Thank you. Question about goalkeepers and young players. Lots of young kids who jump in goal don't have their own goalie gloves. Are they still able to play as a goalie?
Yes, they are. However, it's a matter of you as a coach and your COVID coordinator observing, or any others observing, is that the child, the second that they use their gloves, and for anything else than making a save and dispersing and rolling and whatever it is, the second that glove goes to the face, you're going to have to just basically notify the referee, to that you haven't, it could be treated as an injury timeout, and that you go on out and you either you remove the gloves, or you bring out your disinfectant spray and you spray them down, make sure that there are wipes, and then you continue. So it's just a matter of training kids and teaching kids not to have the gloves wipe away sweat or in the face at all.
Thank you. And this is the last open question we've got. So if you do have additional questions, please start typing them in now. It's regarding schools. Are there any concerns that soccer players come from many different schools, that we could be mixing them up from Mass Youth Soccer's perspective?
So first off is that first off, kids come from many different families. So they're in totally different environments to start with. So when they come together as a team, yes, it's possible that team becomes a compilation of the environment that every child came from. So that's why the importance of the self-certification process before they come in, to make sure that a parent is attesting, they don't have a fever, they haven't been around somebody who's tested positive in the last 14 days, they haven't shown any symptoms, no cough, no sneezing, no respiratory issues themselves and the such. We do as much as we can. And so, yeah, when the kids do go back to school, and then they come from various different schools, everybody's going to be doing everything possible to mitigate the spread with our children. And I think what a lot of people are realizing is the majority of the spread is not going to be by our children, it's going to be by adults, kids over 18-year-old and up. And so all we can do is just trust that parents are telling us the truth when the child's coming, and then we do everything we can. Once again, if a parent feels that they play on a club team that has children from 10 different towns that all come together, and if they feel that that is just not risky, not something they want their child to participate in, they have all the right to say, no, thank you, we're going to sit the season out. And that's their privilege, and we should respect that. Just the same way we have, I think it's up to 6 or 9 Patriot players who have decided to forego their salary for the football season and sit out the season because of concerns that they have for family members and themselves.
Some questions regarding not having teams in certain towns. If a town doesn't have a team, can a player participate in a town soccer program in a neighboring town?
So it is permissible that if a town program does not have a team, that through an agreement that they can play on a neighboring town as long as they register and affiliate. However, the other town does not need to accept them. If the other town is trying to keep the team makeup confined to residents of that town, that's fine. However, folks, I live in Methuen right on the Drake line, and COVID doesn't know the difference between the boundary. So, if I had a child that was playing in Methuen and Methuen decided not to participate and wanted to go play in Drake, and Drake would say, yes, it's fine, or no, that's their prerogative. But what we're hoping is that we can get as many people to pull together to provide children the opportunity to play, as long as they feel they've got it controllable and manageable, and the parents are okay with it. By the way, sorry to my friends in Methuen, I know you guys are going to make smart and intelligent choices.
Similar question, this time regarding siblings. If 2 siblings from different age groups, the parents are asking for them to play on the same team, is that allowable? So,
well, as long as it's age appropriate for the team, which means one of the children is playing up, they can't have a child playing down. That's number one. And number 2 is that if the organization feels that, for this time frame, that's something that's suitable, then absolutely, that's permissible. It's an organization choice for sure. One of the things another suggestion, folks, is come this fall, if when league play is going to take place, and if it does take place, is that don't keep any standings. You can have scores reported, but whatever takes place this fall in a lot of communities, a lot of towns, a lot of clubs, the teams are not going to be the same from this fall to next spring. And so you may not be able to assess team strength this fall. So the best thing is let the kids play, keep the standings out of things. Don't put them up on the websites. Don't track them internally for your internal uses. But our recommendation is just don't keep standings.
Thank you. Has there been any towns or cities who've opted out of the fall season at this moment?
I don't know exactly who they are, but I've been informed that there have been some communities that have made the decision just to opt out for various reasons. It could be their local Department of Health has too many restrictions. It could just be a comfort level by the organization, their board, and that's their decision. So we do expect that we will see. We've got 330 plus member organizations around the state, so we do expect some that are just going to take a pause for this fall.
Okay. That's the last of the open questions.
9:02. There we go. Kept it under 2 hours. Just in closing, and I see the numbers are going to be dropping off, but for those people who have stuck around, I'm just going to reiterate is that we are the only ones that are responsible for the success and the outcomes of what our soccer season is going to look like for the remainder of the summer and into the fall. The guidelines are so important. Get to know them, understand them. There will be, some challenges and pain points along the way. Yes, a COVID coordinator is going to need to go through registration and take a concussion course, but that's just a short-term little hurdle to get over, because the role that they're going to play is so vital and very important to our success. The COVID safety officers for every organization, and then the coaches. The coaches are paramount. Coaches, please, please, please do everything possible to have the experience be successful on the field. Don't violate the guidelines. Don't touch players. Stay 6 to 10 feet away. Wear a mask. Because we know that if a coach, as an adult, starts to wiggle a little bit and cross over the line, that is where we start to run into some high susceptibility for spread. It's going to be, we've learned it's limited with players. Yes, the players can catch it. Yes, we have had some situations in our state and others where there are some dreadful, dreadful outcomes to children catching this, but the overall percentages are very, very low, and we're following state guidelines to do everything possible to help us have a successful soccer season. So we thank you for everything that you're doing. Please keep the questions coming in post. We're going to be updating our website. We're going to be providing more training content. We're doing everything possible to provide anybody providing soccer services to our children in the state to have it be successful. Our children's health and well-being, physical and mental, is so important. And we know there's been damage, and we've got to do everything possible to be a part of the solution moving forward for the health, wellness, and safety of our children. So thank you very much. And Rob, thank you for helping out tonight.
Thank you.